now sits at 66,810 cases. That is an increase of 3,107 cases in the past week alone. That brings Peoria to 33,570, an increase of 1,798 cases. Tazewell is now at 25,906, an increase of 1,070 cases. And Woodford is now at 7,334, an increase of 239 cases. Our deaths to date are at 921, which includes 17 deaths in the past week alone for Tri-County residents. That's 442 Peoria County residents, 368 Tazewell County residents, and 111 Woodford County residents. Compared to last week, where we saw 2,777 individuals at home and isolating, today that number is doubled. We're at 4,471 cases in the Tri-County currently at home and isolating. Likewise, we saw a sharp increase in our hospitalizations. Last week, the Tri-County had 64 residents hospitalized. Today, we are one shy of 100. We now sit at 99 cases hospitalized of Tri-County residents. Hate to say it, but the numbers continue to be grim. Last week, the Tri-County was averaging 326 new cases each day. We now average 444. Peoria County specifically was at 167 new cases each day, and our 7-day average now is at 257. Likewise, our hospitalizations continue to increase. While our ICU capacity on average stays the same at 39 beds in use, we saw an increase in our non-ICU beds. For OSF, St. Francis Medical Center, and Unity Point Health, Methodist, Proctor, and Pekin, we now are averaging 156 non-ICU beds in use compared to 114 last week. Today, the hospital systems reported 38 ICU beds in use and 172 non-ICU beds in use, and sadly, 3 additional deaths. Peoria County lies within Region 2, and right now we only have 8.6% of our ICU beds available. Again, only 8.6% of our ICU beds are available. One of the things I do want to comment on today is a couple of updates and changes, as well as requests to the public. First and foremost, as we are seeing that with only 8.6% of our ICU beds available, there is a huge demand on our hospital systems. If you visit the health department's Facebook page, you'll actually see a video from Unity Point Health, very much a plea to talk about what the healthcare community has been seeing. Likewise, OSF has seen an influx in the need for testing. And again, as a reminder to the public, do not go into the ER for COVID testing. OSF, as well as Unity Point, are seeing many worried well patients that have had recent exposures due to holidays or workplace exposures or even schools. The healthcare system is designed for patients to go to the most appropriate settings based on their needs. So many of the worried well, otherwise healthy individuals, should be practicing the same health practices recommended all along. Minimize exposure, have social distancing, wear a mask, practice good hygiene. If you are asymptomatic or having mild symptoms, do not change your course of care in terms of quarantine and isolation and managing your symptoms. You can use telehealth or MyChart to check in if you have further questions. You do not need to go to the ER. Allow the ERs to focus on true medical emergencies and our urgent care locations to address those more severe or moderate health concerns. Visit their website, talk to your healthcare provider, visit the health department, go to the CDC. All of these are places to check and understand what level of care and where you should go. But again, we're asking, if you are a worried well, do not show up into our emergency departments for a COVID test. In fact, beginning January 3rd, you can start visiting the Civic Center. As the governor announced yesterday, there is an expansion of testing at our Civic Center. They will be offering Monday through Saturday testing beginning January 3rd from 8 a.m. to 4 p.m. Again, the Civic Center beginning January 3rd will be offering Monday through Saturday testing 8 a.m. to 4 p.m. and it is free. That site also has vaccines available, which is, again, a huge recommendation that we'd like to push out. Right now, Peoria County is at 56% fully vaccinated. If you haven't had the opportunity, if you are postponing it for a clear in your schedule because you didn't want to maybe feel down or sick during a holiday get-together, or you're waiting for a weekend, please do not delay. I've heard so many people tell me that they have been waiting to get their booster when they've had a free time in their schedule. One day of feeling cruddy is a lot better than getting COVID-19 and then spreading it to others. Don't delay. If you have the opportunity, get it immediately. Again, 24 hours of feeling a little bit under the weather is a small price to pay versus actually getting the virus itself. You can visit the health department. We are doing walk-ins completely Monday through Friday, 8:30 to 4, and that includes all types of vaccines and all types of boosters and all the ages that are currently available. So anyone 5 and older, you can get a vaccine at the health department, whether it's your first, second, or your booster. So again, please, please, please share that more than anything else, that there is no need to wait. You can readily get a vaccine. The other big news that you will notice, especially for the over 400 new cases that happen each day in our Tri-County, is that the state has been moving towards an automated system. If you test positive, you should be expected to get, starting today, a text message. The text message is a way for us to have immediate contact as well as to provide to-date information on what you need to do, what needs to be monitored. This is not spam. It is a valid text message. It will read, and I'm going to try to get the exact language out there, it will read that IDPH COVID. This is important info for you. Call 312-777-1999 or click and it'll have a link for further information. If you get this, please do not ignore this. This is your first step towards getting into our quarantine and isolation protocol to make sure that you are properly monitored and you're provided correct information. So again, if you do get that text message after testing positive, that is your first step into this. It's an automated text message, and there's an opportunity for you to call back. The key phone number, I'm going to say it one more time, is going to be 312-777-1999. This is one of the first steps in a larger change on how we do contact tracing, with more additional steps as we go into the new year. But this was released today. It's gone into effect. And again, that phone number you want to call back is 312-777-1999. With that, I'll open it up to questions.
Are you doing testing at the health department?
The Peoria City County Health Department is not doing any testing on site. We direct individuals either to a couple of avenues. One, if you're just interested because you might have had an exposure, using one of the over-the-counter tests is readily available. If you're having symptoms, talking to your appropriate primary care provider to get tested, and of course now the Civic Center. So we are directing people to those different entities for testing.
And the difference with the Civic Center is now it's going to be open 6 days a week, whereas it was only open 3 days a week before.
Correct. Previously, the Civic Center was only open 4 days a week, but now it will be open 6 days a week. It will not be available on Sundays. That's the only day. And again, we hope that the increased testing will get, one, more people tested, but also, importantly, alleviate the burden that was placed on our healthcare system when people were trying to get tested inappropriately at different locations. So hopefully that will assist our healthcare system so they can focus at the task at hand, which is still trying to get people better, especially those that haven't been vaccinated, which again makes up the primary population and the severity of illness they're seeing in their systems.
What is the turnaround on test results lately?
So the turnaround in test results, I would say, varies where you get tested. I've noticed that some of our pharmacies, it can be anything from 24 hours to 36 hours. For the Civic Center, a similar cadence, it would be either 24 to 36. I will say you might get notified of your test result from where you were tested before the health department or the Illinois Department of Public Health will send you a message. So again, most of you that have signed up or done testing will have a text message or some sort of app connected to your result, and oftentimes you will get that first before it comes to us. And the reason why is it comes through to our systems in batches versus you are just one and done, right? So again, if you get your result, you should expect to get a text message rather quickly after that.
And the Civic Center would be the only walk-in option for a test, right? Everybody else pretty much wants appointments.
Right now, the Civic Center is walk-in appointments or drive-through, be it that way. There is no other large-scale walk-in system out there. We were looking for appointments, and so both hospital systems and our federally qualified health center, you can either call to make an appointment or use one of the apps that are available. They're My Charts. But again, really consider why you're getting tested, whether it's a worried well, whether you're asymptomatic, whether you are having mild symptoms and want to check kind of what your exposure is. All that information on those kind of places you can get tested are at the IDPH website, along with each of those hospital system and healthcare systems as well.
Now, from what I understand on the worried well, you're better off to get a lab test than to do it at the pharmacy, right?
So when you say the worried well and getting a lab test versus the pharmacy, so pharmacies can sell over-the-counter tests, which you will do at your own home, and the results no one knows of. You are the only one that knows of that. The health department doesn't know if you tested positive or if you did it appropriately. But now some pharmacies will actually administer the test or watch you do the test yourself. They enter that into our system. So we would know if you went through that route at like a Walgreens or a CVS, we would be notified of that test result. But if you purchase a test and take it home, we don't know or known about that. So for a worried well individual who might have a mild symptom or was at a holiday get-together and is kind of wondering whether or not they are positive, they are not, they don't know if they've even been exposed to someone, one, it's not necessarily for you to test, but if you are just that interested, an over-the-counter would be your best bet to purchase something and actually do it yourself versus going and getting a PCR test. Again, knowing, one, your symptoms, what kind of exposures you had, did you have a known exposure, were you identified as a close contact? Those are all going to kind of determine where is an appropriate place for you to get tested and what type of test you should get.
I have just a couple questions. So the CDC actually just changed the quarantine from 10 to 5 days. Any thoughts on that? Why they changed their decision and how should Peorians react to that?
So the news yesterday is the Centers for Disease Control and Prevention, or the CDC, updated their quarantine and isolation guidance. This is based a lot on data that we've been collecting over 2 years now, understanding when people are the most infectious, when they can transmit it, and so forth. On top of that, now we have a year's worth of data for vaccinated individuals to see how they're able to transmit and so forth. So the CDC guidance is based on the data that's been collected, looking at vaccination status, as well as the different variants that we're seeing and when people have their most infectious period. So we're learning a lot more. Again, if you think about that first year, we had stay-at-home orders, so our data was even skewed slightly in that essence. So with a lot of that real-world data, we're able to make those updates. Now, in Illinois, because much like everyone else, IDPH is reviewing that guidance and will make any appropriate updates. So I encourage individuals to look to the health department's website as well as the Illinois Department of Public Health for any updates. As you've seen, they've really oftentimes come out quickly with a recommendation to adopt such CDC recommendations. So, that may be something we expect to come through. But again, they were just notified, similar to all of us, yesterday as well. So again, the changes are based on data, real-world data that we know, along with now landscape that has vaccines. And likewise, once the state adopts that recommendation, you'll see subsequent changes out there.
Sure, and with respect to that automated system you mentioned, so if I get a text message, right, does that mean, so that's for contact tracing, right? So how would my name get on that list? Would it be from a text?
So the way that the automated system works is once you get tested, we get your information, right? That way we can contact you with results. And one of the first things that comes through will be a text message to you that says, you've recently tested positive. We'd like to set up a time to do an interview and work with you on monitoring your symptoms, as well as identifying where you might have gotten the virus, as well as, there could be some high-risk situations. Then we'd follow up with an interview. Now, if for some reason, bad numbers and so forth, you're going to still be followed up or get contacted through a different avenue. It might be through your local health department versus a text message if your phone that you put down was not operational. But the goal is that everyone will get information as quickly as possible once they test positive so they understand what is expected of them.
And how big has contact tracing been lately? I guess I haven't heard of much of it going on. I could be probably wrong. But I mean, I guess how robust is the contact tracing system, and how much? So if I get asked for an interview or something, how much time might it be?
Ask for this, yeah. So contact tracing, again, is one of the tools public health uses to identify cases and kind of like risk factors to understand where this is spreading. Early on, it was really on controlling it. As we've moved through this pandemic, we're really focused on understanding your risk and the risk you pose to other individuals. So, we still prioritize contact tracing. So individuals that we feel have a high risk, whether it's illness or death, they're going to be our first call. So that's that 65 and older population. So if we, for example, we use contact tracing to identify commonalities. So if we start seeing outbreaks, that we can go in and address those outbreaks as quickly as possible, because we've noticed, especially last year before the vaccine was pushed out fully, that an outbreak in our long-term care facility could really create a lot of cases and sadly a lot of death. And so again, a lot of our contact tracing is focused on those high priority individuals so we understand what is occurring that's creating this. Some individuals, it might be a singular case, others might be attached to a larger outbreak, but that's what contact tracing does. If you do get communicated with a contact tracer, the initial interview usually takes about 15 to 20 minutes, and then after that you are signed up for a monitoring of a survey, and then that's done at your own pace daily. But it's really that initial interview that takes the bulk time, and it can be 15 to 20 minutes usually.
And we're in the middle of the holiday season, almost New Year's, cases are climbing. What's the best way to stay safe and just, try to avoid cases to go up?
So great question as we are entering that second part of the holiday season right now. What can we do to stay safe? First and foremost, get vaccinated. Get your first, your second, any subsequent doses, as well as a booster. We can't reiterate this as much as possible. I think someone made a really good comment, which is that as we see variants, is cases really the most important number that we're looking at? And no, it's going to start becoming hospitalizations and that healthcare capacity. That's why you've seen the full page ads by hospital systems across the state. I think Ohio just had one where the word was help. It's all it had on there. Because even if we have an influx of cases, if the severity is still impacting a group that's unvaccinated, it's still going to be a huge burden on our healthcare system. So again, first and foremost, get vaccinated. And we're seeing, different narratives of this. We're seeing out in New York City right now, hospitalizations of children are going up because they are one of the most unvaccinated populations that they have. So again, first and foremost, get vaccinated. When you're out and about, wear a mask. Masks work. They've been shown to be effective routinely. So wear a mask. If you're ill, don't go places. Get tested. Self-isolate, self-quarantine, follow the directions of your provider, of your local health department. But first and foremost, you can get vaccinated. It's the easiest thing to do, and there's nothing stopping anyone. They can, right now, they can go walk into the health department, and there's a bank of nurses ready to give you a vaccine. So please, go get vaccinated.
I almost went there this morning.
Great.
No,
Now, and I will say this, the other thing to make sure that you are aware during holiday season is be realistic about expectations. I know, I saw recently that I posted on my own media account a while back that this time last year, we got our first round of vaccines. And I was looking forward to this holiday specifically because I thought, we have vaccines. This is great. We can see the light. And sadly, I spent a holiday season making sure that my family was safe, which meant routine testing, because we were finally getting together. And even though it was a small group and we tested routinely and we were fully vaccinated, this is not what we expected this year. So again, as much as we want to celebrate and be with others, be safe, acknowledge the fact that we're still in a pandemic, people are still getting sick, and our hospitals need our help. So again, get vaccinated, wear a mask, and stay home if you're sick.
My very last question, just how has it been for you? We're coming at the last quarter of the year. How has this year been with its ups and downs? Just any kind of discussion.
That is a great question. How it's been for me, I will say, as usual, did not expect to be in this situation, but I am most grateful for the fact that I have an amazing team at the Peoria City County Health Department. I will say this to anyone who will listen. We are blessed to have such an esteemed amount of professionals in one community that just focus on improving the health of this community, whether it's a pandemic, whether it's lung health, whether it's lead in homes, food safety, you name it, and they give it all day in and day out. And so I'm very grateful and the work they do to keep this community safe. And so while it has had its ups and downs, the consistency has been the high caliber of staff at the health department.
Yeah, just going back to testing, I've recently online been seeing a lot of people kind of being hesitant with the test results they might be getting, especially with the new variants coming out. Are we seeing any problems with more false negatives coming up, or do we have a handle on that?
So even with the variants, the authorized tests that are available are able to determine whether or not you have COVID. Now, what is different is that there is surveillance testing that's done on samples to determine which variant it is. So when you do go to get a Binax now, for example, or get a PCR test at the Civic Center, getting that result of a positive COVID is a positive COVID. What people, I think, are wanting to know is, do I have the variant? Do I have Omicron or not? And that's a totally different type of genomic sequence testing that's done. And we do that on a surveillance side. And on that note, my next answer is going to be yes, Omicron is in Peoria County. We have identified cases of it. And we expect that to soon become our most dominant strain here locally.
Do you have a number on how many cases there are right now?
I do not have an exact number of how many I know, but I do believe that last week we had our first case.
And kind of going off of that outbreak, the outbreak at the jail, do we have any updates on that? Any news regarding it?
So the outbreak is still at the jail, is still continuing on investigation. We're still doing testing continuously there. And again, a great partnership between the Peoria County Sheriff's Office as well as our County Emergency Management Agency. We're able to get a state asset to do testing on site there to, again, alleviate the burden of an overworked nursing staff. So again, that is still continuing monitoring, but they're doing all the right steps. Sadly, in our congregate settings, they're high-risk situations, and so, one of the ways that you can alleviate any type of outbreak scenario is getting people vaccinated as much as possible.
Yeah.
What day did you determine that there was Omicron? You said last week, what day?
I can't tell you the exact day. We do, the state releases on their website sequencing numbers, and they believe they do it on Mondays, Wednesdays, and Fridays. And so I would say it was maybe, I'm looking at Diana Scott, RPI, I believe it was either Saturday or Sunday, they did release that we were one of the counties that had identified case.
How many counties in Illinois have identified it?
I'll get back to you on that one. I don't have that number with me. But I believe there was a press release regarding that just last week, so it might still actually be in that press release.
Okay.
Yeah.
And hearing that a new outbreak is in a community, a new variant, I should say, what words do you have for the community? It's obviously a very startling thing that a lot of people are still confused about or worried about.
So I want to make sure we're using, common language, right? So, outbreaks happen when we have a lot of cases that are associated to a certain exposure. So a super spreader holiday dinner or, living in a congregate setting. All of those can create outbreak scenarios. Having the new variant, though, it just, much like Delta, it adds another layer to our response. And again, what we're seeing from the data is having a booster is really effective, masks are really effective, and our tests are able to detect COVID even with the variant. So the tools we have still exist and are still very strong. So I don't want them to say not to be worried in essence of it's not something to be concerned about, but it's not something to be concerned about when you have all of the toolkit available. So I think my response back would be what I can say to the public is, yes, we have that variant, but you also have the way to respond to it. So make sure you're taking your vaccine, you're getting tested, and you're staying away if you're sick.
When you say it's more transmissible, what does that mean? Does that mean you're more likely to pick it up at the grocery store in a casual encounter? What exactly does that mean?
So when we say a variant is more transmissible, it means that for every positive case, you are able to get other individuals ill. It could mean that your viral load is higher. It could mean that the strength of what you share is in a different mechanism. All of those. Having just walking by someone, at the grocery store is not what we mean by transmissible in that essence. It's more of the impact that we see in terms of binding and how the virus interacts with the body. So in that case, if something is more transmissible, it is able to spread faster into more individuals. And what we're seeing, going back to the CDC data as well, is that with the variant, we tend to see a shorter period of time when people are infectious, but they are very infectious during that time period.
Okay. When you say shorter period of time, how long would it be?
2 days prior to when symptoms starting and up to 3 days after is usually when we're seeing the highest infectious period of individuals. And so again, the CDC, using data such as that, are looking to make updates, and hopefully we'll see IDPH also, recommend the same changes as well.
So 2 days before you start showing symptoms, and then 3 days after you're done, so you could be sick for a month, or you could be sick for 2 days?
3 days when symptoms start, excuse me.
3 days after symptoms start.
Yes.
Okay, so typically really infectious for 5 days.
Just another question about testing sites. In East Peoria in particular, it just seems like whenever I drive around, it's a new building says, hey, you can get tested here, just walk in. In particular, there's one over in the corner of Springfield by the Festival of Lights that just about shuts down that street because people are constantly in line to get tested. Is that run through the state? Are you guys aware of those testing sites? Do you get the results for them?
So I would say this for testing sites in general. I know we've gotten a lot of social media questions related to this. First and foremost, I would say visit the Illinois Department of Public Health testing website. They list all of the testing sites that are either permanent or even pop-ups. So this time of year, a lot of communities say that they might be doing a Festival of Lights and say, hey, I'm going to have 100 cars parked here. Do you want to set up a testing site as a way while people are waiting in line? The state does that, but that will all be listed on their website. So first and foremost, if you're looking for a testing site, go to that website to see it. if you have questions and you have concerns about a site, if it doesn't feel like it's legitimate to you, don't utilize it. We have a lot of other mechanisms in our community to do. So I would always say, first and foremost, go to the website to see what sites are actually listed, and that would be where I would go. And that partly is related to, one, a state team that's out there, as well as making sure that it has been laboratory-approved testing site and using the type of test that actually would be reporting back to the state.
There are people on Facebook who will say, I will come to your home and test you. Should you trust that?
No, you should not trust individuals that post on Facebook that they will come to your home to test you.
What kind of test could they be using?
I'm not sure what kind of test they could be using. It could be that they are just purchasing over-the-counter tests, but the key is those are individuals that are not reporting those results. So again, make sure you're going to a valid website to look for testing and then utilize those resources. Well, I do not believe we have a briefing this Thursday, as we had one today. And I'm actually looking to Diana because I'm not sure if we have one next week either. But our PIOs will notify you of our next briefing. Probably next Thursday. Thank you, everyone, and have a good New Year.